Good afternoon, I'm Michael D'Alessio, Captain of the Staff Services with the Town of Greenburgh Police Department.
I'm Paul Feiner, Greenburgh Town Supervisor.
Jared Rosenberg with Greenburgh Police Department, the EMS Services.
Sergeant Sean Hagan, Greenburgh Drug and Alcohol Task Force.
How often are you trying to assist in drug overdose cases, especially opiates?
So how often are we,
Yeah.
so, I mean, without knowing the exact numbers, but up until like the whole Michaels incident that you saw, that was back in January, I think there was like 7 just that month alone, but I think on about an average.
Yearly from last year.
I don't recall how many we had last year, but I'd say you're looking at close to maybe about 5 times a month. It seems that, as far as we know, is responding as to rescue people, and treat them. That's probably not including the people that are possibly that overdosed and died out there. So, yeah, I think there's definitely an increase. Just based on the amount of Narcan, the antidote that we're pushing. So there's definitely been an increase in it, and I'd say an increase in death because of, it's not like the old days where it was like really just straight heroin. Now they're mixing and, dabbling with fentanyl, which is, just much more lethal. So we're definitely seeing a lot of that.
So how has the amount of cases changed over the last years?
That's a very good question.
I mean, the cases are increasing, and the drug that, the antidote that we use, we used to be able to give very little of it, and now we're giving more of it. So, so the stuff is, just stronger and more deadly, I guess, is the best way to put it.
So what challenges are you facing?
What challenges?
Yeah.
I mean, the biggest challenge that I'd say we face is probably just like safety of everybody. There's different ways to, there's different ways that addicts can use it. So, I mean, one thing that we're always cautious about is if they use the needle. Obviously, it's an easy way to get stuck and catch a disease. The other ways are pretty safe too, but we make sure we have our police bodyguards with us, because if you take someone out of, you take an addict or an overdose, you're going to put them into withdrawal when you, give them the antidote. So, so as far as safety, we're just really, it's our safety precautions and stuff like that. Some patients are calm when they wake up and some aren't too happy. So,
From a police perspective of the safety is we also, when we responded to like an overdose or handling the drugs, you got to use gloves, and sometimes we even mask up because you don't know if anything's airborne. But you don't want to touch some of these drugs, especially that has fentanyl in it. You can get yourself sick, and could be fatal at times.
Has any police officers ever from Greenburgh gotten sick dealing with these drug instances?
Not that we're aware of. I don't.
not in Greenburgh, but
there's.
there's documented studies of officers or EMS crews in other jurisdictions, not around here, that had to like self-administer their own Narcan to them. They felt like, they felt the signs and symptoms and they administered it to themselves. So.
And so how are you training your first responders?
So, I mean, all everybody in our department's been trained. All the police officers are trained on, basically what does an opiate overdose look like. So, the most important thing to remember is someone called, all right, and so we have some idea of the possible overdose. If they know the patient, then we can get a little more information. But besides that, all our first responders are just looking for the signs and symptoms of an opiate overdose. So it could be pinpointed pupils, and basically, what we're really there is for the respiratory rate. If the respiratory rate's less than 10, and you have pinpointed pupils, or you have paraphernalia laying around, or someone knows what's going on, you can kind of put it together. and then we're going to administer the Narcan, the antidote. So,
The police officers, though.
yeah, police officers have it, EMS, everybody we work to on the front line now is practically carrying the naloxone. I think we've been implemented for about 2 years now, if not 3. So I just went through my first major recycle of the drugs, so they last about 2 years. So we're somewhere right between, like, I think honestly 2 and 3 years maybe.
Well, actually, we've been deploying it with our police paramedics and civilian paramedics.
Right, EMS has had it for like decades.
Yeah, so the
You know.
department has actually been deploying it for quite a long time. It's just recently that we've deployed it with our police officers, so they can get quicker response times out there.
Right. And they're usually, they're the first out there. The police officers usually first on scene, and a lot of them have done a great job with saves alone. I think there was about 14 saves last year. I mean, there's really, they're pretty alert to what they need to pick up. So every officer carries, so every officer up until this year carried a total of 4 milligrams of Narcan, and this year we increased it to 8 milligrams on each officer because with the fentanyl, you can't wake somebody up with like less than 8 milligrams. If they're really overdosed, you really need a good 8 milligrams just to get them to stop breathing. And that,
Yeah, I was going to ask, does the Greenburgh police have an education campaign, and is government doing enough in terms of educating people? I mean, are we reaching out? Are people?
I mean, there's a lot of the Department of Health has a lot of outreach programs, and we are listed on one of the websites for the DOH. It's why we get the drugs for, the antidote for free. No one ever calls the police department for training or anything. I've been over to the Drug and Alcohol Treatment Center. I trained the staff there, but beyond that, most of the training we've done has really been for all the frontline responders, the fire department, police departments, EMS. We probably, unincorporated and incorporated Greenburgh, we've done all the, police officers and I'd say most of the EMS agencies.
And the other question, I just had another question, is that okay? Demographic-wise, is this like, are people from every different income area and section of town involved in this, problem? Or
It doesn't discriminate.
It doesn't discriminate?
Every neighborhood, and
There's no
affluent
profile.
neighborhoods, poor neighborhoods, it doesn't matter. It's
College
every
age,
neighborhood.
professionals.
And it goes from young to older people too. A lot of it stems from what I find mostly is someone getting injured or having an injury, and they start out with the Percocet or the oxycodone, and they can't get that anymore, and they graduate to heroin. And, a lot of the stories are sad that it happens that way, but, those are victims that fall, they have addictive personalities, and they take these drugs, and they, the doctors now, or the medical field is trying to control all of that, control the oxycodone that they prescribe.
So I guess like at the college level, people are taking the drugs, and then at the older ages, is this more of a, like for middle age, or is it?
It's the same throughout.
You could be a high school player, get injured, go to the doctor, and they'll prescribe some type of
When
opioid.
they get, right.
Or you can be involved in a car accident or slip and fall when you're a little bit older in life, and the same thing, they'll prescribe those.
And then basically, and then they get hooked on.
Oh, we're not saying that happens every time, but you see that's the trend that even the attorney generals throughout the country have been instituting lawsuits against the drug companies, saying that they're pushing it, these opioids out there.
I think, and you might have, read about this, I think the county of Westchester now has sued, and I think there were over 200 as a result of you. I did some research, so I could take, if you become a professor, I'll have to take your classes. But the thing is, I think there were over 200 counties around the state that actually are around the country that are actually suing, right now, just like the county of Westchester.
It's kind of like the strategy they took with the tobacco companies, where they sued the big
Yes.
tobacco and, were pretty successful.
Yeah.
How are the local police departments from other towns cooperating?
How are the other police departments?
I think it's,
From other communities,
Yeah.
right, Yannick?
Well,
That's
yeah.
what you
I
mean.
mean, in Greenburgh, the task force that I run is basically from all the communities within Greenburgh. It includes all the other incorporated villages, and we deal with all the, the dealers and people that are overdosing. We're responding to them, trying to find out who is selling them the drugs. But we work throughout the whole town, the incorporated and the unincorporated area.
Mhm.
So, I mean, in all the departments, all the chiefs are all on board. I mean, they're all good, with the cooperating and everything like that.
Even countywide, right? You guys will-
Yeah, and there's a countywide initiative going on. It's called the Opioid Response Initiative, and they have a meeting like every month. Pretty much most of the county PDs are represented there by somebody, but they are taking, they also brought in someone from White Plains Hospital, an ER doctor, explaining, they all feel that there is a problem, that there's not enough going on to help these people that are sick. And one of the ER doctors actually came in and said that, when he sees a patient that overdoses, what they do is they treat them and then they send them on their way. But they need somebody to come in and speak to them. This doctor is trying to take initiative to have somebody come in and speak to them and give them help and show them where they can go for, rehab and stuff like that.
Is the county doing enough?
The county, they're trying.
I think the county's doing as much as they can do.
People need to want the help, to get the help. So I know there are other programs out there with police departments that, they have it out there that if you want help, come to the police department. A lot of people are sketchy about going to the police department for help, but they say their program is working, so
And I guess are a lot of people in denial?
people in denial,
So people basically don't consider themselves drug addicts when they're really hooked on it?
Yeah, they know, they know they are, but the problem is, going to get the help, that they want the help. And a lot of these overdoses are actually people that have gone and are clean for 2-3 weeks. Then they come back out and they're okay for a little while, and then they fall back into it, but they try to do the same amount as they were doing when they went into rehab, and they're overdosing because it's too much for their body, or it has fentanyl in it.
Okay. What kind of support are you getting from the regional level, Westchester County, and from the state level?
The only thing that I deal with as far as the state level goes is we're at least getting the antidote and the naloxone for free.
Okay.
So, one of those, each officer has 8 milligrams, that's what one box is. And if you Google it, you're looking at about $135 a box. So what do we have, like 120 officers? So if you kind of like do all the math, it's an expensive crisis. So at that level, we're definitely getting a lot. Like Sergeant Hagan said, the county's doing, they have all these different task forces, and they're just, trying to get to the bottom of it.
A lot of what the Westchester Opioid Initiative is basically wants information sharing, because your drug dealer here is not just dealing in this part of the county. It's also, he may be dealing in another jurisdiction where there may be not, years ago was not the communication that there is now. There's a lot of communication going on, and when you put all the information into one database and they cross paths, then everybody gets together. You start working with that jurisdiction. We all start working together, trying to, basically get the big fish. But, you just, information sharing is very important, and working together is, yeah, you get people selling the oxycodone out on the street, and they're getting the prescriptions. They may not be taking it, but they're selling on the street. The pills, I think they're getting like,
it's a multi-front battle. It's not only the illegal drugs, but the legal drugs that are being improperly prescribed by doctors, where you see prosecutions of doctors increasing too, because they'll write, thousands and thousands of prescriptions to just a few individuals who are going out and selling them. So, you know, maybe with technology, they'll be able to track the prescriptions a little better. You know, the drugstores, the pharmacies have to do tighter controls. I think they're doing with electronically. With
Yeah.
prescriptions now, they have to be electronically submitted, so the controls are tightening in there, but always, you know, if there's a market, you know, people are gonna figure a way around it.
So do some of the doctors get paid by the prescription companies, or by the drug companies?
You know, that's a little bit outside of my expertise, but I think there were some news reports that there were incentives for them to
Yeah, because
push.
my wife
these,
showed me
different
like,
types of,
my wife showed me like a website where you could find how much money the doctors are getting from the pharmaceutical
They're like
companies.
Pharmaceutical companies are always, you know, paying the doctors to push their, you know, if they come out with a new drug, they want to push it.
So on something like this, if let's say a doctor prescribes a lot of, you know, medication, isn't that sort of like a way of sort of tracking down?
No, I think they're tracking doctors.
They do now.
Right.
They're tracking prescribers, I mean.
It's a lot different than it was years ago. I mean, now they, like you said, they curbing it. They're trying to stop these doctors from prescribing. So you come in, you have an accident, and you need painkillers. They used to prescribe you like a month's worth of pills. They're not doing that anymore.
And those are labor-intensive investigations where, you know, you might get a police incident report that goes to an investigation in the local police department, then it gets kicked up maybe to the DEA or to, you know, federal law enforcement or the attorney generals, because, you know, that's a different jurisdictional issue. So, I mean, it's all labor-intensive. So, those are some of the issues that local law enforcement are dealing with.
What kind of prevention programs have you implemented?
I mean, most of the training that I've been involved with, like I said before, is all you know, your frontline people that are doing the rescues, but you know, I spoke to someone yesterday actually just about Dobbs Ferry schools, and they won't even let you in the schools to talk about opiates. So there's and it's hard to believe. I mean, it's an epidemic, and like I can tell you, heroin's been pulled out of Dobbs Ferry before, and there's not, you know, they won't. I was told they will not allow you to come in and talk about opiates, which I just think is crazy to educate.
Any
the kids.
reason?
No, I didn't really push the issue any further. I had just spoken to someone that was involved with the recreation and Dobbs, and
What about the other schools?
I haven't researched other schools, but you know, I think that I mean, I can't even speak to DARE. I mean, do DARE programs exist anymore? Or?
Some jurisdictions, none.
DEAR wasn't really as effective, right?
Right.
Well, I think it was effective. I mean, it depends on what study you look at, but the budget doesn't allow it, so
Yeah.
not our budget.
I think it's just generally the education of society in general. However you get it out there, you know, public service announcements, discussions like this, local news reports, going out to the schools and just informing them of the dangers. And just, you know, all the news reports of all these local overdoses, you know, starting to hit home. Because there's not one person throughout the year that's going to say, oh yeah, so-and-so OD'd, or that one died from an overdose, and, you know, this one was found in an overdose. So I think just that somebody in the family or a neighbor, kid, or the doctor's kid, or whoever's kid has been affected by, I think generally just the awareness out there in society. It's becoming, you know, more prevalent, and, you know, parents are educating themselves more about, you know, what's the doctor getting. Obviously, you know, a kid's an adult at some point, and, you know, they have the right to their own medical treatment. So, but just, you know, teaching them the dangers of the prescriptions.
Well, I can't.
Schools sometimes, depending on, you know, what the message is, or, you know, specifically, I mean, generally, we've been in schools before, and we've given lessons on, you know, like, before they go off to college, we do college awareness and safety courses. You know, we've taught that in the past, so I'm not sure exactly, specifically what, in our jurisdiction, what we are and what we're not, but I think that's our first step, is going out to educating the kids in regard to the dangers.
And also, I think, you know, sometimes you could call like a school, and they may not you may reach somebody, the wrong person, or they may not be focused on it, or they may be doing 20 other things and they're just too busy to answer. So I think maybe our job is to encourage people to talk about it, and once one school starts getting involved, then, other schools will follow. I mean, it was, Time Magazine did a whole issue about 2 weeks ago on the opioid crisis. That was the only stories they had was relating to this. So it was interesting because after you contacted me, then I read the whole magazine. So this was actually, for me, it's interesting. For me, it was actually very useful because as a result of, your contacting me, then I got interested in the issue. And if you hadn't contacted me, I probably would have, it's just something that I really wasn't focusing on. So I really want to thank you. And, again, now when the police say, they need more resources for education or whatever, I shouldn't, he's the head of the union. But now, as a result, I'll be more sensitive to this.
Yeah, very
I
good.
mean, generally, police departments are there to solve problems and help people, so if they have the means and the ability to do it, school districts will come, hey, can you give a class, or can you do this, can you do that, and if they can, they generally try to do it.
But, it's interesting also that of all the issues that come, before me, this is the first time anybody ever, contacted me about opiate. The opioid crisis is such a national issue. And that really highlights one of the problems because it's a crisis nationally, but people who are like the victims, people who are suffering from it may not be aware what it's doing to themselves as much. So we have to do a better job of making people more aware that they're taking all these medications, they're really harming themselves, and they shouldn't be in denial.
The Alcohol and Drug Treatment Center only reached out to us to educate them on how to use the Narcan or the naloxone, but we haven't gone that far. I mean, kind of like Sean said, I mean, there's budgetary things and we're on the front line. So, I mean, that's been our biggest focus is just, worrying about that. And, there's obviously, we could help educate, but you need, I think you need other people out there too to educate, other healthcare workers. So.
And also you have to get people not only in the lower income areas, but in the more affluent areas to recognize that they also have, a problem, and they have to recognize it. They have to recognize it.
What steps should I take when encountering a potential overdose victim?
Dial 911.
Yeah.
Always.
That's it. I mean, the only thing you can do, like, if you don't have the antidote, the only thing you can do is call 911. If they stop breathing, you start compressions.
Yeah.
But besides that, you really need to get, the front line there, get the naloxone on scene, and hopefully they'll get there in time and make a huge difference.
Which departments in your town are involved dealing with this crisis?
It's basically the police department, and maybe as a result of this interview, maybe we'll also focus on grants, and there may be some other people who would be involved in that. I would think the Theater Young Community Center might be, involved a little bit, maybe the Recreation Department because they have a Meals on Wheels, program to deal with seniors. Maybe they should be involved in this also.
Mm-hmm.
So, what is your strategy to coordinate efforts to prevent overdoses?
Okay, well, first of all, before, you interviewed me and told me about this, I really didn't have a strategy. I knew the police were involved in it, but now, as a result of this, I'm going to be more involved, and I'm going to really try my best to, to monitor what the police are doing on this and to focus on education.